My name is Sandy, and I've been a child life specialist for over 30 years.
And my name is Tara, and I've been a child life specialist for 2 years.
I became a child life specialist because I had an experience in a hospital myself as a young child. And in the 1970s, things were very different than they are today. And I wanted to help kids better understand all of the things that happen in the hospital and cope in a more positive way with those experiences.
And I have experience working with kiddos with disabilities from growing up, and was actually working in a different field and had learned about the field of child life through that. So kind of made a career change and wanted to support kiddos in the medical setting because of that.
My day so far has been mostly spent in the MRI suite, where we have patients coming in for sedated MRIs. It's very difficult to stay still, and so we have anesthesia help with that process. And I spent most of the morning down in that part of the hospital today.
My day has included seeing some patients on the peds floor, going down to pre-op, helping to explain what surgery looks like to kiddos, and going to fluoroscopy as well to help with the procedure there.
I think a lot of people, when they hear child life specialists and they see us carrying our bags of distraction items and toys, they think immediately that everything about our job is a lot of fun each and every day. And we deal with a lot of very hard, challenging situations with kids and families, have difficulty coping with being here. And we help to provide some emotional support to them. And not just pediatric patients, but children and grandchildren of adult patients as well.
Coping spans from anything walking into the hospital for the very first time to being here for an extended period of time, to dealing with an end-of-life situation, whether that be for the individual themselves or from the perspective of a caregiver. So part of our job is to support kids and families in those situations.
Thanks to the UPMC Pinnacle Foundation, we have access to a lot of different resources that some other hospitals don't. For example, we have a VECTA mobile sensory station that can help kids with autism or other behavioral or sensory challenges cope more positively with being here in the hospital. We also have MRI movie goggles that really help kids who don't need sedation then for an MRI, which a study can take from 30 minutes to 2 hours, depending on what it's for. We also have a lot of end-of-life resources that were purchased by the foundation for us to give to families in the event that they find themselves in that situation. I'm not sure how to explain that to children.